Let's talk about America's almost universal private healthcare system versus the UK's national healthcare system. American healthcare consists of lots of bills, lots of insurance forms, lots of go-betweens when it comes to you and your doctor, lots of referrals, lots of surprise charges and changes in your network every single year. UK healthcare. You can see a doctor, whoever's local to your council. You go in, you get whatever you need, and you leave without having to pay anything at the door, without having to worry about getting a bill later, without having to worry about if it's covered under your insurance. A lot of my fellow Americans who have never, ever seen anything about the NHS before are literally sitting there in shock. And a lot of my fellow Brits are sitting there saying, what do you mean you get a bill after the fact? I know, it's really shocking when you think about the stark differences in healthcare alone between the two regions. And I have to say that that is just the beginning, because healthcare works so differently even within the UK. So here's what you can't do in the United States as far as healthcare is concerned. Here is how the UK does it, and I'm going to do my best to break down the differences between England, Scotland, Wales, and Northern Ireland from my perspective and my limited experience so far. And no matter what side of the pond you're on, or even if you're in a different country, I want you to really pay attention to the details, because that's where the devil lies. As an American living here in the UK, I knew ahead of time what I was getting into as far as the National Health Service on the surface. But once I actually started living here full time, I was absolutely blown away by what you can do here, even though it's a single payer healthcare system. From free GP visits to mental health support to hospital visits and emergencies. The US healthcare system is mostly private. When I say mostly private, there are two government-funded programs that are available to the public as far as healthcare is concerned: Medicare and Medicaid. One represents retirees and those over a certain age in order to help supplement any healthcare needs they may have. The second covers anyone under a certain threshold of salary, so basically those that are in really extreme poverty. Even though those two programs do exist, they are severely underfunded, they are severely means tested, and it is very, very difficult, even if you do meet all the criteria of either program, to actually get proper healthcare under either program, even combined. It is entirely dependent on insurance, high out-of-pocket costs as premiums, which are what you would normally pay out of your paycheck, not to mention additional costs that you incur throughout treatments and even after the treatment is finished. Co-pays, which are payments that you have to make when you actually walk into the doctor's office to see the doctor. This is on top of any of the premiums that you pay in advance out of your paycheck to pay for your insurance. Anything you pay to get into the door to see the doctor is applicable to your deductible. However, the premiums that you pay to have insurance are not. You experience lots of delays for uninsured or potential financial stress. The UK has the national healthcare system. You probably know it as the NHS if you don't live here or have not experienced it. It's funded by national insurance, which is something that comes out of your wages every month. It is free at the point of use for most residents, so it's very rare that you get a bill once you go in for treatment, no matter what the treatment is, even if it is severe, surgery, an emergency, anything like that. There are some smaller charges in some areas of the UK for prescriptions, for dental, sometimes eye care. In England, the standard NHS system with GP registration and A&E, which is emergency room visits, free at the point of use. In Scotland, prescriptions are also free and has the same GP and A&E registrations. In Wales, prescriptions are mostly free and some dental charges still remain. And in Northern Ireland, you get the free GP visits and some prescription fees. The biggest difference, right, is no bills at the door. In the United States, you hand over your insurance card, you pay your copay, and then sometimes get a bill later, on top of all the premiums that you're paying just to have insurance coverage anyway. The first time I walked out of the GP without a bill, I was checking my pockets twice. And I literally had anxiety for a couple months afterwards, thinking I was going to get a bill in the mail, because that's what I'm used to under the American healthcare system. I'm very happy to say it actually never came. The next thing that I've noticed that to me is a huge plus being under a single payer healthcare plan is less paperwork. So automatically you have less stress. In the United States, there are mountains of forms, and the person who is covered, you, the individual, is responsible for filling out all the forms, for referral forms, for making sure that each GP or doctor has all of your medical history, for your insurance verification, for your pre-approval, and making sure that you're registered and re-registered almost every year, especially if you change doctors or you change locations or you have some kind of medical condition where a specialist has to be involved. In the UK, you register with your local GP one time, and that's it, unless maybe you move out of the county. And then you book your appointments as needed. I believe in Scotland, you have an e-consult, which is an online system available, which is kind of cool. I haven't seen it available in England yet for me personally, but I would venture to guess that it's probably existent or at least in the works. Wales has GP systems similar to England, and it's sometimes faster booking online. I always book my appointments with the NHS online. I've never really had to talk to anybody, which is fabulous. In Northern Ireland, there are fewer online booking appointments, but it's still far less paperwork that you have to fill out than you would in the United States. So the United States, prescription prices vary wildly. Like, they are really crazy sometimes, especially if you have chronic conditions for some reason. Insurance impacts affordability first and foremost in the US. And contrary to a lot of the rhetoric that's been around for the past few years under very different presidencies and of all parties, they haven't really lowered drug prices for the individual in America. It's very, very minimal. It's kind of like around the margins. And most people, especially those who have like chronic illnesses, have not felt any relief really. In the UK, much more affordable. In England, you do have to pay per prescription, minus some exemptions, but it is around 10 quid per prescription. Also, in Scotland, Wales, and Northern Ireland, most cases have free prescriptions. Basically, Americans are shocked. You walk in, you tell them what your illness is, they prescribe something, and you go pick it up. And you don't have to pay anything at time of pickup. You don't have to worry about the bill. It's incredible. And if you do have to pay something, it's so minimal compared to what I used to pay in the US for prescriptions. And it's really hard to compare. It'd be better probably if we had free prescriptions in England. So that is incentive to move to one of the other areas of the UK someday maybe. But for now, I'll settle for the 10 quid and move along. Now, in the United States, we have emergency room, which is the equivalent of A&E here in the UK. And visits to the emergency room cost hundreds to thousands of dollars. I know lots of people who went to the emergency room. I went to the emergency room once as well when I was pregnant, and I got a bill in the mail for the ambulance as well as being treated when I got to the hospital. I know people who have had to stay in the hospital for a week or so and got a tremendous amount of bills afterwards as well, even if they drove themselves. These are all for emergencies or things that are, something you can't handle at the GP level, right? Something that's very urgent. For example, mine was a pregnancy issue and I couldn't go right to my doctor, my OBGYN. I had to go to the emergency room to have it checked out. And it turned out everything was fine, but I still got a bill in the mail after the fact, even though it was an emergency and it was considered necessary for me to go to the hospital. In the UK, again, free at point of use, but you do have the negativity that you are going to wait sometimes, especially if they're very busy. But if it is an emergency, they are going to bump you up the list. And of course, if it's life-threatening, you will be put at the top of the list. In England, A&E waits can be much longer than the rest of the UK, but again, priority for urgent cases. Scotland and Wales has a similar system, often shorter wait times for certain services. Of course, it depends on the priority and urgency. Again, and in Northern Ireland, smaller hospitals can lead to longer travel times in order to get to and from, and possibly longer wait times. But again, no payment at the point of service. And if it is an urgent matter, you will get bumped up the list. So you might wait a little bit longer in England if it's not an urgent matter, but at least you're not going to be bankrupt while you're doing it and have all that added stress on top of your illness or your injury, knowing that this is going to cost you so much more money later and wondering how you're going to pay for it over the coming months as you're recovering. So many Americans, myself included, and just about everybody that I knew back in the United States, often panic over the costs of medical treatment, of insurance, and all of those surprise bills afterwards. Not to mention the fact that everybody has complained at least 10 times in their life about how the bureaucracy and the red tape and all of the procedures and paperwork that you have to fill out is just overwhelming, annoying, and aggravating, and how we have to answer the same questions over and over again every single time that we have to go to the hospital or see the doctor. British people tend to just shrug and carry on. Even if the wait times are a little bit long and the forms are a little bit confusing, they kind of figure it all out together. I've never had an encounter, nor has anyone that I know of anyway, has had an encounter where they didn't understand what was going on, where they were filling out paperwork even though they didn't really know what they were signing their name to, and didn't have to worry about an emergency not being tended to. Of course, there's also some subtle regional differences. In Scotland, there's more informal relationships with your GP. In Wales, it's a strong focus on community health initiatives. And in Northern Ireland, it is a smaller system, so there's a closer patient-doctor connection. Personally, for me, I don't mind about having a close personal connection, but I don't have any like severe or chronic health problems where I would feel the need for that. I personally just like the fact that I can have a conversation with someone, tell them what I'm feeling, and get what I need. I haven't had a ton of experience with the NHS so far personally, but a lot of people in my private life have in the various years that I have known them, even though they have complained about wait times and maybe specific instances with doctors or nurses, etc. Overall, all of them absolutely love the NHS. And even though they recognize it's a very imperfect system and needs help, they still would take that over the American system almost any day. Even those who tout private insurance, because private insurance is available here in the UK. They have a hybrid system. It's not all the NHS. Private insurance is affordable because it has to keep up with the NHS. It often is only limited to certain services, and when it comes to emergencies or major surgeries or anything like that, they usually direct you to NHS doctors and hospitals anyway. So overall, for me, the key takeaways really are that the United States has always cost me lots of money, lots of stress, lots of anxiety, and most importantly, lots and lots of time that I didn't really have to devote to it. In the UK, it's definitely less cost, even for someone like me that has to pay a premium when I renew my visa and get my residencies approved in order to stay here and have access to the service. You get different trade-offs. You get maybe wait times and some small fees when you're in England, but overall, it's definitely a much better system. It's a much more efficient system, and more people get treated than don't, which is starkly different from what we have in the US. I'll tell you that right now. Of course, there's a cultural shift where you just have less stress. You have a little bit more of a relaxed, relationship with your GP, and you have a lot more perspective on how to eat healthy and a lot more access to be healthy overall. I think those are all wins, but I'm curious what you guys think. Let me know in the comments. I know there's lots of people that have had some negative experiences with the NHS, and some of it even dire, and I'm not taking anything away from those people and their experiences. But from my personal point of view, having lived under the United States healthcare system for many decades, As compared to what I have lived under for the last couple years, I will definitely take the UK system and the NHS over the American private healthcare system any freaking day of the week.